Typically the people that look for or ask for sedation during their dental treatment are those that come in with a high anxiety towards their dental treatment, or maybe they've had experiences in the past that they've now psychologically it's a barrier to them getting treatment done. The other reason for somebody choosing sedation during their dental procedures would be that the procedure itself is something that they don't want to know about or remember or know the particulars or frankly be bothered with. We ask patients to get a ride in so that they'll have someone to take them home as well. There's a kind of a groggy feeling that somebody might have, or the sense of waking up. It would be like analogous to maybe jumping out of bed in the morning and running straight to work without no time to stop and shower or even gather your thoughts, but immediately going to drive. IV sedation is the safest form of sedation during procedures, and that's true with dental procedures as well, because it can be individually titrated to each patient. There is not a need for guesswork as to whether or not somebody will take the typical dose or whether or not they require a higher dose. That can all be titrated immediately. It's also very safe because you have access to that titration ability. You can put somebody, give somebody a little bit more sedation, or pull it back a little bit. Also, you can reverse any kind of sedation drugs immediately with that route being used. Also, emergency medicine is very easily given because it's ready to go. Emergency medicine, typically things that happen that would be an emergency would be something to do with somebody's heart or an allergic reaction or somebody's breathing, and those drugs can be delivered instantaneously while they're being sedated. There's oral sedation, which is done by just using pills to sedate patients. That can be completed in a matter of probably 24 to 36 hours of class work, along with passing exams and having facilities and checked and equipment verified by the state. Sedation training is very serious. You have to become ACLS certified, which is Advanced Cardiac Life Support. You have to be able to read ECGs and EKGs and see heart rhythms and be able to be competent in emergency medicine. When somebody is sedated, their mind is not really aware of what's going on. You'll always hear somebody tell a story of waking up during a procedure. Most of the time, conscious sedation is exactly that. People are still aware, but they're not concerned about it. But sedation is not the way that just because somebody's sedated does not mean that they are not numbed up. We numb up patients during their procedures. So even though they're sedated, they do receive local anesthesia to make the comfort of the procedure acceptable. Typically, patients to be sedated in a conscious sedation setting in a dental office outside the hospital, the patients need to be fairly healthy. Their blood pressure, their heart, all those things need to be controlled, and if they are taking any kind of medications for any ailments or conditions, they need to be regular on those things. They need to be very healthy, so that they're not at any kind of risk to endanger them. But most patients fall under the category of being safe or being able to be treated with sedation dentistry. If patients or the public are having a hard time getting up the courage, or they have some misconceptions about their dental work or the procedures or anything, sedation is there so that those patients can receive their treatment and not put off their dental health, which can be an overall indicator of how well their general health is. So sedation dentistry should be used for somebody that is avoiding any of the treatment that they need to keep their lives and their bodies healthy.